for our webinar, Increasing Cervical Screening for People with Disability. And these little images that you can see here are actually the animated talking cervixes from the Screen Me campaign to increase awareness about cervical screening for people with disability, which ran last year. So I'm going to move on to the next slide, and I'm going to hand over to Tammy to do the acknowledgement of country. Over to you, Tammy.
Thank you, Deborah. I'd like to acknowledge the lands that we're all meeting on today. I'm coming to you from the lands of the Palawa people in Nipaluna, La Truita. I would like to pay respects and honour elders, past and present, and Aboriginal people who have joined us today from other lands across the country. Aboriginal people have suffered through colonisation, and it is testament to the strength and kinship that we have a community today. Aboriginal people are the continued custodians and traditional owners of this land, from the red dirt country of the centre to the lush green river country and salt-booked country surrounding us.
Thank you so much, Tammy. So I'm just going to introduce who we all are. Welcome to you all. We know that you're a mixed group of support workers, family members, people with disability, and healthcare providers, as well as other people with an interest in health equity. So I'm Deborah Bateson. I'm a professor here at the University of Sydney. My background is as a medical doctor, a medical director of family planning for New South Wales for many years, providing services for people with disability. I'd like to introduce Marianne. Would you like to introduce yourself, Marianne?
Thanks, Deb. I'm Marianne O'Donovan. I'm the CEO of the Centre for Disability Studies. We are a not-for-profit organisation that works with people with intellectual disability specifically, and we're based at the University of Sydney. And delighted to be here this evening.
Thank you. And we're going to be welcoming and joined by the marvellous cervical screening advocates with lived experience of disability who are going to share their experiences. We've met Tammy, who's done the acknowledgement of country, who's from Tasmania. We'll also meet Sue from South Australia. So what are we going to look at in this webinar? Well, the first thing to just centre us all is to know that cervical cancer is one of the easiest cancers to prevent. And we're going to be understanding the cervical screening test, including the newish choice of having a self-swab. We're going to understand the rights everyone has who's having a cervical screening test. What are your rights? Very important. And we'll have a think about what makes it difficult and what makes it easier for people with disability to have a cervical screening test. We'll understand the National Cancer Screening Register and its important role. And we'll think about how supporters can help people with disability to have cervical screening. And we're going to hear from the cervical screening advocates. So just a bit of housekeeping now. We will have dedicated question and answers, so please do put any questions you've got into the Q&A box, which is at the bottom of your screen. We'll also have a short break in the middle of this 1 hour session, somewhere around 5:30 for 5 minutes. We've got live captioning, so what you need to do is go to show captions in the meeting controls at the bottom of your screen and select your preferred language. We've also got Auslan interpretation. So again, if you click the interpretation icon, it looks like a little world on the toolbar. And if it doesn't show up, you go to the More section where it says More in inverted commas if it's not visible, and then you can select Auslan from the language list. So don't forget to ask many questions. We're here to help answer them. So our agenda is quite simple. We're going to just start with some background on cervical screening. We'll have a quick break between 5:30 and 5:35, and then we'll hear from the screening advocates and open the floor to you to ask questions of anyone. So let's just start to talk a little bit and set the scene around cervical screening. We do know that cervical cancer is one of the easiest cancers to prevent. And Australia is predicted to be the first country in the world to eliminate cervical cancer by as early as 2035. And this is because of our HPV vaccination program for girls and for boys. It was introduced in 2007. And it's also because of the shift. We were one of the first countries to shift from pap smears every 2 years to HPV tests for the human papillomavirus, which I'll explain. And this big switch of the program happened at the end of 2017. And what we know is we're on the path to eliminate cervical cancer, but we must do this equitably. And this includes for people with disability and not leave anybody behind. So let's have a look at this human papillomavirus. So HPV, it is for short. And we know that this is the cause of almost all cases of cervical cancer. The key thing with HPV is it's a very common virus, but mostly it clears by itself. The body clears the virus and it doesn't cause any problems. But sometimes the HPV stays on in the body, it's not cleared, and it can cause changes to the cells of the cervix, which could, many years later, lead to cancer. So just so we're got the thought of the anatomy in front of us. Some people aren't quite sure where the cervix is. There's a talking cervix, animated cervix at the bottom. So the cervix is inside the body. It's actually at the top of the vagina. And it does look a little bit like a donut, I suppose, because it's the entrance up to, it's a column, it's a passageway, if you like, up to the uterus. So that's where menstrual blood comes out. And also, if someone's having a delivery, then that's where the baby comes out. So that's the important role of the cervix. And how can we prevent cervical cancer? Well, I mentioned HPV vaccination. That's for girls and boys aged 12 to 13. And if you miss out, someone misses out at school, they're not there on that day, for instance, then they can go to the GP up to the age of 25 to get a catch-up vaccination for free. We've also got cervical screening, which I mentioned, and that's for all women and people with a cervix aged 25 to 74 years of age, and it happens every 5 years. And there's now 2 ways to do the test. People who are a bit older will definitely remember the pap smear and how it was taken. And we still can have that way of taking the HPV test. That's a doctor or a nurse taking a sample of cells from the cervix. They use this special instrument. You can see Dr. Yvonne there from family planning. She's demonstrating on the right-hand side the speculum. And that's used to visualize, to open up the cervix so the doctor or nurse, so we can see the cervix and then take a sample of cells with that soft brush that you can see there. So that's one way of doing cervical screening. But now we've also got another way of doing cervical screening, and that's actually taking the sample yourself from the vagina using a self swab. And if you've got problems doing that yourself, or you lack confidence, you can always ask the doctor or nurse to do it for you. And that swab, you'll all be familiar with them, really. It looks a little bit like a COVID swab, I suppose. And it just goes into the bottom part of the vagina and you rotate it around a couple of times. So there are lots of common questions about the cervical screening test. And one is self-collection, you're taking it yourself with a self-swab, is that as accurate as when the doctor or nurse does the test with the speculum? And the answer to that is yes. Both ways are very accurate. There's no difference between how accurate they are. And the other common question is, does having HPV, have the doctors told me or the nurses told me I've got HPV, does that mean I've got cancer? And the answer to that is no. HPV infection is very common and mostly it goes away by itself. But sometimes we do need to explain to you what to do next, and I'll talk that through because the doctor or nurse will advise you on what you need to do to help stop cancer developing. So HPV doesn't mean you've got cancer at all. So let's have a look at what happens with the test results. Usually, if you go to the doctor or the nurse, you'll get the test results in about 2 to 3 weeks. You'll work out with the doctor or nurse how you're going to get those results. They might ring you, you might go into the clinic to get the results. Most people will have no HPV detected on their test. That means they can actually safely be tested again in 5 years' time. So that's a good thing for people to know. Some people, a small number of people, will have, if we go to the right side, the pink boxes there, they'll have the types of HPV called type 16 or type 18. And these are the types of HPV which are more likely to go on to develop into cervical cancer if they're left. So what we do if these types are found, then we actually refer you, your GP or nurse will refer you to a specialist doctor for a special test to look at the cervix closely. And sometimes we take little pieces of tissue called biopsies to check what's happening. And you may need to have some treatment to the cervix to stop cancer happening. In the middle, there's people who have other types of HPV. They're less likely to go on and develop into cancer. They're more likely to clear by themselves. So we know that for this group of people, it's safe to test them in 1 year's time from now. It's really important that everyone who's eligible for cervical screening knows their rights. They know that everyone, including themselves, can actually choose to have the cervical screening test. We want everyone aged 25 to 74 with a cervix to know that they're eligible for a screening test, but you can, of course, make an informed decision not to have a test as well. That's your right. It's also your right to see a female or a male doctor or a nurse, and you can ask to see a female, for instance, if that is your preference. You can ask for an interpreter, including an Auslan interpreter. You can decide to take a support person with you to the consultation with the doctor or nurse. They could come in for some of the time or all of the time. That's your decision and your choice. Or you could decide to go to the doctor or nurse on your own. And a very important thing to be aware of is if you're having a test, particularly the test with the speculum, it's really important that you know it is your right to say stop, able to stop this procedure. And the doctor or nurse has to stop because you've asked them to during the test. It's really important to understand these rights. So what are some things that make cervical screening difficult for people with disability? Well, they can be at different levels. They can be at the level of the society. We know that stigma and discrimination can mean that people with disability get less preventive healthcare than other groups, for instance. People may have financial difficulties, making it difficult to see the doctor or the nurse. There can be a lack of sex education at school, so people with disability not having that same understanding because they haven't been given that education. We need to stop this happening, of course. And we do know that there's high rates of sexual abuse in institutions for people with disability, and this can be a barrier for cervical screening. And we want people to know there is that choice of the self-swab, which might be easier than having a speculum examination. We know from people with disability that they tell us that they can feel fear and anxiety about having a cervical screening test, find it scary and frightening, and they might have had past bad screening experiences. And again, we want people to know that there are different ways of doing cervical screening now. Healthcare providers, I'm one myself, we like to think that we've all got the skills and confidence to provide inclusive care, but we do know that sometimes healthcare providers do need to build their confidence, have training, and we're doing that with care providers now to make sure they have got those skills and confidence. And if you feel that someone's not communicating properly with you, it is your right to speak out and say, I need you to go more slowly, I need more information. There can be assumptions about sexual activity that perhaps someone with disability isn't having a consensual sexual relationship, and so they don't need cervical screening. So we need to make sure that healthcare providers don't have these misassumptions. They can be very busy with lots of competing health demands for people with disability, and sometimes cervical screening might be missed out. And sometimes the clinics themselves are just inaccessible. Other things, health systems, lack of accessible information and invitations and reminders to screen. We're hoping to change all that now, and we want to make sure that there is accessible information. And we do know that costs to see the doctor can be prohibitive, be negative, and mean a real barrier for some people to get to preventive health care. And we know that families and support workers, meaning well, of course, but sometimes can be overprotective and think that the person with disability wouldn't cope with a cervical screening test, for instance. There again can be misassumptions about whether people are sexually active and needing to have cervical screening. And sometimes family and support workers perhaps aren't as up to date with information about cervical screening themselves and may not know there's a different way of doing that now with a self swab. So we can make cervical screening easier for people with disability by letting the clinic know about any additional needs and supports before they come up. You go for an appointment. You can ask for longer or multiple appointments. And you can ask clinics about whether they've got height adjustable tables and equipment such as hoists. And it's all about supporting choice for people with disability, letting the person speak and supporting people with disability to speak up in the consultation for themselves, using accessible information. and letting people know it's okay. Don't have to have a cervical screening test today. You could take your time and come back another time when you feel ready. People can choose, of course. We want everyone to know that there's the choice of doing your self-swab yourself as well, and helping people understand their rights is important. So I've given you a lot of information now, and we're just going to take a bit of a short break, just so you can just sort of recalibrate a bit, and we'll see you back here in in 5 minutes from now. But do have a break now, and don't forget to put questions in the Q&A as well. Thank you. Welcome back, everyone. I hope you enjoyed that very short break, but we're going to get on now with the rest of the presentation and hear from the cervical screening advocates, of course. So let me just move to the next slide. And we're going to be talking now about the National Cancer Screening Register. So what is the role of the National Cancer Screening Register? Well, it's a personal electronic record. It contains information about you and your health. In this case, we're talking about cervical screening. The National Cancer Screening Register also has information about the bowel screening program, as well as the lung screening program as well. So this record, it's very safe, of course, and private, but what it can do is quite a few different things you'll hear about. It can send invitations to people when it's time for them to start screening at age 25. And these can be sent either in the post as a letter, but you could also choose to have an SMS instead. And the reminders to have cervical screening are sent every 5 years for cervical screening. It also provides a bit of what we call sometimes a safety net for people where they've been referred, for instance, for a closer look at the cervix, that I mentioned before, to a specialist, but there's no record of that person having been to the specialist. So the register might follow up with your doctor or the doctor or nurse to find out if they've had that visit to the specialist, and sometimes they may follow up with you as well, with the participant in the program. So we're going to meet Margot here. So Margot is a woman with lived experience of disability, and those of you who've seen the Screen Me film as part of the Screen Me campaign will recognise Margot. So Margot is going to turn 25 in 3 months' time from now, and she gets a letter. The letters are sent out a bit early. Gets a letter about her first cervical screening test. Margot talks to her sister Augie, and she goes to the clinic with her. Margot shows the letter to the doctor, and she asks also for support with participating, with joining in the cervical screening program. She feels she needs some additional help. The doctor, first of all, looks at the register, and the doctor can see on the register that indeed Margot's due for her first cervical screening test. She also checks her address and finds that Margot's address is out of date. And so with Margot's permission, she can actually update Margot's address in the register. So that's helpful. The doctor also lets Margot know that she can choose someone to help her take part in the National Cervical Screening Program, help her participation. And this person is called a personal representative. And of course, a personal representative, it's a choice for someone to make. You don't have to have a personal representative at all. And many people with disability, of course, don't need that at all. They can find all the things out, participate in the program without that help. But some people may feel that they do want that help. And it also could be for someone, for instance, who speaks a language other than English, and they need help from someone in the interpretation of the letters, for instance. So it's just someone who wants that additional support, which can happen. And Margot actually wants her sister, Augie, to support her. So she chooses Augie to be her personal representative. Augie is kind and listens to Margot. She understands what Margot wants. Margot says that she feels nervous about having a cervical screening test. And in fact, she decides she doesn't want one today. She needs to think about it a bit more, and she's very glad that Augie is going to support her. So the doctor actually gives Margot easy read information about the cervical screening test, all about it, to take home. So, of course, because now we've got Augie as the personal representative for Margot. Margot, of course, is going to get the letters in the mail to remind her about future cervical screening tests. And Augie will get the letters too. And that makes Margot feel quite happy, I have to say, because she knows that, she's not going to forget to make an appointment again in another 5 years. What I should have said was actually, Margot did come back with Augie in a week later after she'd read all that information. And she did have her very first cervical screening test, a self-collected test. And then Augie and Margot came back for the results, and they found that there was no HPV detected. So she can come back in 5 years' time, which is quite a long time away. So Margot's very happy to know that she's going to be reminded, and so will Augie. So this is some of the information that was given to Margot and to Augie. This is from the Screen Equal project. It's a research project, and there's been co-produced, co-designed information, which is now on the National Cervical Screening Program website. We'll send all these links to you after the webinar. But there's some excellent information, brochures which you can download or just read them online before my cervical screening test, during my cervical screening test, and after my cervical screening test. I just want to give you a bit of information about what you need to know about this National Cancer Screening Register participant portal. So this is for anyone who's in the cervical screening program. They can access information about participating, about being part of the program through this portal, which is accessed through MyGov. And I'm sure most of you will know about MyGov. You can have it as an app. It's where you can link information such as your Medicare information. You can link your screening information, and it's all together there in one place. And what you can do if you're in the participant portal is it helps you manage your participation. You can update your personal details. So if you've moved house or you've changed your phone number, you can do that yourself in the through the app and through this portal. You can update your communication preferences. If you decide that you'd actually much rather have SMSs than letters, you can do that through this system, through this portal. You can look at all the previous correspondence that you've had from the cervical screening program, including the date of your last cervical screening test, so you know when the next cervical screening test is done. And what I will say is that this portal it doesn't contain private health information. So there's no private information about your test results, about anyone's test results on this portal. It's really just to help you manage things like, making sure that people have got your correct address to send the letter of reminder to. Now, what about if you choose someone with disability in this case, but it could be anyone, in fact, chooses that they want to have a personal representative. So again, who can this personal representative be? Well, it is a trusted person, of course, someone that is looking after the best interests of that person with disability in this case. That can be it can be a legal guardian, it can be a family member like Augie, or it could be a friend. Just knowing that this person, cervical screening is every 5 years, so a long-term friend could play that role. And how do you, what we call nominate, how do you get someone to be a personal representative? Well, it's the person themselves who can call the register or go online. You could get some help with this. The doctor or healthcare provider, for instance, could help you nominate someone to be the personal representative. So this can be a useful function, a useful tool for people. And the key thing for us all to remember is, of course, supporters, you play such an important role in helping people with disability to get cervical screening. It's all about helping people to make their own choices. And of course, we're all respecting the rights of people with disability to be in control of their own lives. And I do just want to remind everyone about the CHAP. This is the Comprehensive Health Assessment Program. It's an evidence-based tool for conducting annual health checks or assessments for people with intellectual disability. And it includes information to make sure that people are getting cervical screening, for instance. So there are some really important tools. But I'm going to stop talking now because you've heard enough from me, and we're going to hear from the screening advocate. So I'd like to introduce you to Tammy Mill, and to Sue Lewis, and over to you both. So Tammy, I'm going to hand you over to introduce yourself and let people know a little bit about why you wanted to become a screening advocate.
Thanks, Deborah. So I wanted to become a screening advocate because just recently I had a pretty horrific experience undergoing some testing for cervical cancer, and I actually hadn't had a test for 13 years prior to that, because the one 13 years ago was pretty horrific too. But when I went in this time, it was so much easier. And that's when I learned about self-collection. And so I heard about this program and thought I need to be telling people what I've learned about self-collection, learning more about self-collection myself, and spreading the word about how easy and accessible it is. Now, there's less likelihood of having to have that speculum, and you can do it yourself, and it's just, it's wonderful. If it can be, if having a test like that is wonderful, then this is wonderful. Yeah.
Oh, thank you. And Sue, over to you.
Yeah, hello everybody. Yeah, my name's Sue Lewis and I live in the Adelaide Hills, beautiful Ghana country. And I'm physically disabled, with lived experience, obviously. Tammy and I are going to do a little bit of role play now. So we've met up for coffee. So
Excellent. Over to the role play, and I should just let people know that, in fact, there are 7 cervical screening advocates with lived experience. They'll be coming on to different webinars, and we've been just sharing time together about supporting people around, sharing stories, sharing experiences, and it's been just a wonderful, wonderful time. So Sue and Tammy, over to you.
Hi, Tammy. How are you going?
Yeah, great, Sue. How are you?
Well, I'm pretty good. I'll tell you, I went to the doctor's, my usual appointment,
Yeah.
and in the waiting room, there were some little brochures, and it talked about cervical screening, because as a mature woman, I'm very familiar with the old pap smear, and you avoid doing it. So I went in and I was very interested in this self-collection. So I asked the doc about it, and she gave me this kit.
A kit?
Yeah, a kit. And in the kit was almost like a stick, the same as sort of COVID ones, but longer, and a tube.
Yeah, yep.
And then she said, all you need to do is to swish it up, put it up your vagina, swish it around, put it back in the tube, take it back to the doc.
So when did you do that? Did you do that in the toilet, or did you?
Yeah, I did
home or
bathroom at the doctor's. I could have taken it home, but obviously I was happy to do it myself, because it's like a tampon, I suppose. If you've had experience of tampons in your life, you could use that. Yeah.
So it's not as thick as a tampon, though, is it?
No, it's just it's like a giant cotton bud, really.
Yeah.
A bit like that. And the test is as good as if you'd done it with the speculum. It's just as reliable.
Yeah, reliable, you mean?
Yeah.
Yeah.
The results are really good.
Yeah, cool. Right, so I might have to go in and check this out myself. So I don't know if I'd be able to do it myself. Is there someone there can do it, or who can do it?
Yeah, you'd need to get the doctor or the nurse, not your carer.
No.
And I mean, it depends on the family member, but the recommendation is that the doctor or the nurse does it, and they can do it. They know what they're doing, and then they can do what they thought it. So for you, that might be the best option, but it's not that you don't have to use the speculum. It's just that nice thin giant cotton bud.
Giant cotton bud. You said like a cotton swab, is that right?
It is. I've got it here.
Yeah.
I've got it here.
Deb's got it there. So thank you very much. I'll see you next week.
Yeah, no worries,
Thank both of you.
Bye.
Well, fantastic. That was absolutely fantastic. And you're absolutely right, Tammy and Sue. I'm so glad you raised the issue of what we call assisted self-collection sometimes. That, you make a decision that you prefer to have a self swab, a vaginal sample, not to have the speculum examination, but you can't do it yourself for a variety of reasons, or you lack that confidence to do it, and you can ask the doctor or nurse to do that for you. So I think that's a really important thing to put over. But thank you so much. It's great to hear from you both. And I know you're going to be answering lots of questions later, so that's fantastic. So we're just going to move on. I just want to let everyone know about going to this fantastic website on the National Cervical Screening Programme. So it's all about the Screen Me campaign that was developed last year with Bus Stop Films. They're an inclusive filmmaking company, absolutely marvellous company, organisation to work with. And this short 4-minute film was actually at the heart of this campaign, and it really we had tremendous buy-in, and you know, an enormous number of people actually watched the whole film all the way through. So it's also on this site. There's also the accessible information about cervical screening, so everything that you need to know about cervical screening is there. So we've just got some take-home messages, and then we'll open up to questions. So Australia wants to stop cervical cancer. We want to eliminate it, and we must make sure that we leave no one behind, including people with disability. Self-collection can be a useful choice for people with disability, using that self-swab and getting assistance if you need it. And support people. You have an important role in helping people with disabilities to have a cervical screening test, whether that's helping with an appointment, checking whether there's the right equipment, as to just making life easier to have a cervical screening test for people with disability. People with disability, we need to remember if they may need additional support, of course, for follow-up after their test, if they're going to go to the specialist for that special test, which is called a colposcopy. They may need to have additional appointments and extra support. And don't forget this personal representative function. It can be a useful tool for some people with disability. Not everyone needs to use it. Many people, don't see any need for using it, but some people may find that it's really helpful to help them just take part and participate in the program. And do check out all these accessible resources. We'll send you all of the links to them. But now I'd like to just acknowledge the Department of Health, who've helped fund this program. And thank you to our interpreters, my colleagues, and to all of these fabulous screening advocates. So we've got Tammy, we've got Emily there, we've got Polly, we've got Sue, we've got Carleen, and we've got Lena there as well. So it's really fantastic to have these advocates, and just a big thank you as well to everyone behind the scenes, to Emily, to Lauren and Arena and Edie. Thank you. So we're going to open up now for questions from you. We've also got some other questions. I can't see the questions, I have to say.
No, it's okay. I can see them, Deb. I wonder if we stop sharing the screen, how people can
That's a good idea. I can
see one another. And there's
That
a
would be
couple of
great.
questions that have come in. So thanks everyone who's already shared a question. If you do want to ask the question yourself, just put up your hand, or if you want to add to the question, but I can't see anybody's hand actually. That's interesting. I can only see us, but I'll ask the question. So Danny says, not sure, and we hadn't asked the question. We said, I have a spinal cord injury and I can't easily open or hold my legs to do it. Is there any directory of doctors available to go to that can perform the test for her?
No, I'll answer that question. That's
Yeah.
a really important question, so thank you for asking it. I do know that the Department of Health will be working towards having this information in a central place, but what I would recommend now is that every family planning organisation, there's a family planning organisation in every state and territory, and you can get in touch with them and they should be able to direct you, or they might be able to provide that service themselves, or at least find out where you can make sure that you can access that service with the appropriate skills and expertise. So thank you for that important question. And we do want to, through this work, encourage more GPs and nurses to be able to provide these services for people in the community with disability, of course. Yeah, excellent question. Thank you.
Great. And Tammy has her hand up, so I'll go to Tammy and then I'll go into the Q&A again.
Sorry, I just wanted to actually back up what Deborah said, because I'm a person with disability as well. My lower limbs are, I don't know, what do you say, non-functioning. And so I do need some assistance as well. When I went to the doctor, it took a sport worker and a nurse to assist me with the self-collection even, so to hold my legs. So, and the doctor had never met me before, but we still managed to get it done, and it was like fairly painless and not that stressful.
That's great to hear, Tammy. I'm sure Danny appreciates you sharing that experience as well. So thanks, Deb and Tammy. Another question, and this came in before the role play, so but I'll still ask it, and the advocate or Deb might want to come in. But it's just asking for clarification around the pap smear and the new cervical screening test. Are they the same, or are they different? And maybe if we just unpack that a little bit more.
Yeah. I mean, Tammy and Sue, do you want to go first, or should I kick in and then I'll hand over to you?
I don't mind.
You go. You go.
Thank you. Just my experience, though, not clinical experience.
Yeah.
So the pap smear is what's used with the speculum, and a small scraping of the vaginal wall is taken. But the self-collection is the use of like the swab, which is a COVID test, and that just whizzes around inside the vagina with no sort of intervention or, you know, cutting or hurting. It's really, really easy.
That's fantastic, Tammy.
That's great.
Thank you. And just to just bring in a couple of little things. So you're absolutely fabulous. So the pap smear was testing. It was taking a sample of cells from the cervix. So you're absolutely right. People did used to say scraping, but it was taking a sample of cells from the cervix and checking those cells under a microscope to see if the cells had changed. So we changed that because there was a discovery in the world that almost all cases of cervical cancer are caused by that HPV, the human papillomavirus. And now the new test does exactly what you said. It tests for HPV infection, and that's either looking for infection at the cervix if you've got a doctor or nurse using the speculum, or it's in the vagina, as you say. It's actually looking for infection in cells in the vagina. So they are different tests, and this is much more accurate than the pap smear, and it has to be done less often. So that's a very good thing. More accurate and less often. So it's really good.
That is really positive. And when Tammy said when Tammy said scraping, I made a face. I must apologize for that, but it just brings back memories of that scraping. Like it was the actual word that would come to mind for me as well. So it's a very accurate. Yeah. So there's another question about the personal representative function. And it says, could the personal representative be a generic house supervisor of a site someone lives at? So I'm presuming in a group home or something like that. Can it be the house supervisor?
Marion, do you want to answer that? I'm happy to give it a bit of a go, but I wonder whether you would want to have a think about that.
Yeah, well, I think who can be the personal representative is quite open in terms of who are the circles of support around the person, who's involved in their life, who knows the person well and can provide that support. And I think it's really in partnership with the person in terms of identifying who's the most appropriate person. So there's not this person can't be, but it's more about who's really the most appropriate person and knows them well.
I think that's right, Marianne. And I know when we've had discussions with, we've talked to big disability organisations, the managers, the CEOs, and lots of discussion with lots of different groups. And generally, it's thought that it's better, rather than it being someone who's in a paid position, if you have someone who may change. Obviously cervical screening is every 5 years. Then, ideally, it could be a family member or a legal guardian or a trusted friend. But it is about making sure, yes, that it's the right person for you. Because it is also, it's a private thing to be doing, isn't it? To be changing someone's address, you need to be very trusted to have that ability to perform those functions in that personal representative function. So, well, I think it's about talking it through. We know that generally doctors and nurses are generally not performing that function of the personal representative. But of course, doctors and nurses are the people that you see to let you know about the results, make sure that your address is up to date and all of those things. So I think it's about working out who the best person is in that circle. Tammy and Sue, you might want to add in, I think.
Yeah, I think it's somebody who you've possibly known for a while. And, it's one of those enduring friendships, possibly. But the personal representative is not somebody who can do the test. It's somebody who can manage the administration of the test, making sure it goes to the right address, the right phone number. So somebody who you possibly won't lose contact with. I've got a couple of people I would think of could do it for me. And then there's others who I wouldn't. But, you've just got to think about it carefully.
Yeah, great point. Yeah. Definitely.
Tammy, did you want to add anything further there?
No, I totally agree with Sue and what you've said, Deb. It needs to be a trusted person, and it is really only that administration that they're doing the test needs to be done by a health professional or someone that has sort of, clinical experience, not a support worker, or, there's boundaries that we don't sort of want to cross, and just having that layer of protection, I guess, by getting a clinician to do it, you're much safer.
I think you've raised a really important point. I know we've said it before, but it is a very intimate, private examination. It needs to be by someone who is skilled, a clinician who's skilled, a doctor or a nurse, because they understand the anatomy, but also, of course, work by a code of practice as medical, health practitioners. So I think, yes, certainly support workers would not be actually assisting with the self-collection, for instance. That needs to be the health professional. So thank you for raising that.
So there's no more questions in the chat at the moment in the Q&A, but even though you highlighted some key messages, I wonder, Deb, Susan and Tammy and the others on the team, if you want to come in, what would you feel is the main message you want people to take away and perhaps share with other people with a cervix with disability about this?
It's a brilliant development. I mean, as has been noted, the idea of the speculum has put people off, and so they haven't been going for theirs. It's long time. I have friends and who I've explained this to, and they've gone, oh really? And they've gone and had the test. It's such an amazingly good thing that you could try to prevent cervical cancer by 2035. It's just brilliant. It's and that's the message, that it is a good thing and easy to do, and just get it done.
Yeah, great. That's great. Tammy, do you want to come in?
Sure. I had my cervical screening 13 years ago, and then I had it just recently, and the idea that it's going to be 5 years, that I have to wait 5 years, that is great. I don't want to be having it every 2 years like before, and just the ease of the way it was done. I'd be happy to go back every 5 years to get it. And just reiterating that, it's not scary like it used to be with the speculum. It is, so much easier. And as a person with physical disabilities, it really put my mind at ease that I didn't have to sort of, drag myself around and have people holding this and that while it was undertaken. It was just so much easier. Recommended.
Yeah, the fact that it can be done at the doctor's, or you can take it home, rather than you having to have, a procedure essentially at a hospital or a healthcare centre, or wherever. It's so therefore much cheaper in a set, and that's a good thing. The money can be spent on other things.
Yeah, exactly.
More research.
Well, Deb and I would not say no to more research.
And I suppose I mean, they're such brilliant answers. You know, you're a great advocate,
Thank
particularly
you.
for self-collection, because it really has changed
Mm,
the world. I'm just back from a conference where we were talking about Australia's being one of the first
mm,
countries, you know, to adopt self-collection. Just to say now, almost half of all cervical screening tests are being self-collected. And the good thing is that they're in people we know are generally under-screened. So that means, you know, women in remote areas, women, Aboriginal and Torres Strait Islander women,
mm,
people, you know, people with disability. So we're really reaching the people that we need to reach. And we're reaching people who've never been screened before. We can see that some of these people are coming
mm.
having a self-collected sample, which they may not have ever had at all. So
Wow.
so it's really fantastic. I suppose my key message is that perhaps because you've said the other one so eloquently, I don't need to repeat that, is really about understanding those rights and making sure that, you know, if you are in a clinic and the doctor, I know myself sometimes, is talking quickly and isn't providing that accessible information. Maybe they don't know there is accessible information on the website. So, you know, it is, you can help. You don't have to help. It's not your job. But you know, it's we want the healthcare providers to be doing the best they can by people with disability, of course. And I do think that that information, because sometimes some people will need to have a test with the speculum if they have some HPV types that are found. If you remember, you've got no HPV found, come back in 5 years, you've got those types 16 and 18, you go straight to the specialist. But if you're in one of those groups in the middle, and it's about 8 to 10% of people, so 10 in 100 women might have those other types of HPV,
Mm,
then you do need to come back. I mentioned about coming back and seeing if the virus is still there in a year's time. But if you've had a self-collected sample, we do need to check the cells of the cervix. So you do need to come in and have that speculum examination. And you know, people need to understand, to know that.
mm,
And you know, again, it's about understanding the process, understanding you can say stop if you want to, but just making sure that you're in control really,
mm,
and understand those rights. I think it's really
mm.
important.
That's wonderful. And yeah, I think understanding your rights is so important in healthcare and how you make decisions. I was just going to ask a question, if that's okay. Are there any differences between states with the new cervical screening?
Uh, there aren't. So
Good.
the quick answer is it's a national program, which is great.
Great. Yeah.
We did used to have state and territory-based programs. They were still
Hmm.
doing the same thing, but there were different registries
Hmm.
and it wasn't as unified. So now it is a national program. And
Great.
we really want to make sure there is equity, and regardless of your postcode and where you live and how much money you have and all of those things, that you're able to have this life-saving preventive healthcare. It's really important. We do know that there are some challenges, you know, with the cost of general going to see a GP at the moment, and that can be challenging. But hopefully we know the government is looking at it, of course, to work out, you know, how to make sure that we're not putting up any barriers
Mm,
for women having a cervical screening test. And potentially in future, at the moment, we do in Australia, cervical screening is carried out in that primary care, that
mm,
setting. And we may in the future send some kits to people's homes if they're under-screened. But we're not actually going to probably be like some countries where everyone just gets sent a kit in the post, and we know that the return rates are
mm.
very low. So actually, it means that there's much lower rates of screening than we have here in Australia. So we don't want to lose all the good things that we've done so far.
Yeah, wonderful. Yeah. Well, there's no other questions, and I think we're coming up to the hour. If I could just say thanks to everybody as well. I've been a little bit absent because I've been unwell the last wee while, and this is my first day back, and everyone has just done a fantastic job, and it's been a pleasure. It's a highlight of my first day back is being here at the webinar. So It's wonderful. And thanks to everyone that you're not seeing on the screen as well, who've been working so hard behind. For people who have joined out of their day, thank you so much for taking that time. Please spread the word about what you've learned here today. The resources will be shared with you so you can share those further and beyond. And we do have more webinars coming up. So if you want to join again, if you're thinking of questions in between, or if there's other people you know, more than welcome. And we'd love you also to share the fact that there's more webinars with people that you know in your networks as well. So thanks, Deb and Tammy and Susan and all of the team. And I'll give the last word to the three of ye.
I think Sue and Tammy, you need the last words.
Oh, thank you very much. Well, I've thoroughly enjoyed it and highly recommend that all women have it done and think about it tomorrow, because I know there's an awful lot of things you have to think about with your health. There's all sorts of different tests all the time, but if we can eliminate cervical cancer, that's a huge, it's a really good thing to do. So thank you very much for listening to me and for our acting skills, and I'll let Tammy have the last word.
Thank you, Sue. I'd like to thank the Centre for Disability Studies for giving me an opportunity to be involved in this program. The team is just absolutely wonderful, and no question is too silly, and we've been supported through this journey really, really well. It's just been a really lovely experience, and adding to our knowledge along the way has been nothing more than a bonus, really. So thank you.
Indeed. Yeah.
Thank you both.
Tammy said. Yeah.
Excellent. Well, I'll just say goodbye to everyone as well, and thank you for joining us. Do come and join us again, and please give any feedback as well. We'd love to hear from you as well. But I think I have to say that I think the cervical screening advocacy, self-advocates, screening advocates are going to live on, and we'll get more and more around the country. I think that will be good.
Thank you.
Definitely. Good night, everybody. Thank you.
Thank you.
Bye-bye.
Bye-bye.